All right, we're back. So hopefully the feed is a little bit better. I'm getting a perfect streaming signal on my end. Um, Thank you. Hopefully we'll be able to battle on through. So sorry about that, Ed. Thank you for your patience. So we were talking about your work with Western PA and the Coalition and how you guys network with anybody else. Okay, so I'm going to read off this question, Ed, so if it doesn't make sense, I'll try to go. One of our chatters says, healthcare costs for a family of 4 covered by workplace health insurance will exceed $20,000 this year, according to a study released. Do you have an estimate of what a family of 4 might pay in taxes, which we were saying to 4 to 5%? So the question becomes, is it 4 or 5% per person, or is it 4 or 5% total income of family?
It's 4 or 5% of the income of individuals.
Okay.
But the catch is that the median family income in the U.S. today, the median, is about $45,000 a year.
Right.
So if you have 2 people working or 1.5 people working, it's $44,000. So let's say it's 50,000 times 5%.
2,500. Yeah.
Right. So that's what a person would pay, and that's instead of paying in the argument, not the argument, but the $20,000 is what perhaps the employer pays some of that and the employee pays some of that. But that again is an unsustainable system.
Right. So I actually just did the math early on when you were talking about the percentage, and I was like, yeah, I'm ready to sign up for that today, because it costs mine. Would cut my insurance cost per year by 75%.
Right.
It's just like, and then without all the nonsense and the deductibles and everything. And then the second question was that people would complain that on a single payer plan, you're having to pay for you're subsidizing somebody else's care. But if somebody else has good health habits, you're still prone to catastrophic medical events, in which case you would be the beneficiary. So how do you think that all balances out?
Well, again, with healthcare being a human right, and people just don't go, unless I would say, I'm trying to be maybe too glib perhaps, but most people just don't run off to the doctor because they have insurance. Unless they have some type of mental defect, it's not as if people are running off to the hospital and to the doctor because they say, I got to use my health care insurance. So the argument that you're subsidizing someone is just really not true. And because, as I said before, if everyone has the same level of benefits, whether they're rich or poor, then there is inequality spread out over anybody, and that's where the system can only survive under single payer, meaning that's what makes it fair, that's what makes it equitable, and that's what makes it sustainable. Because under the system now, you have people who are truly sick, but under the insurance regulations, they're paying way more money than somebody who's young. So it pits people together instead of spreading the pain out, so to speak, so that everybody gets it when they need it.
Right, we're all covered by the same umbrella for a change, instead of having different umbrellas determined by economics.
Exactly, which I think, again, when you think about that and you say, well, if everybody is entitled to go to the nursing home, everybody can go and get their surgery, everybody can go see the dentist, then the rich people don't have any incentive to say, oh, I'm getting something more than Mark's getting, or Ed's getting something more than I'm getting. If everybody's getting the same, then everybody has an equal say or an equal part invested in maintaining those services.
Right. And so somebody asked a question as you were talking about that, is there a concern that single payer access to care, because now it is equal, will flood the system and make it more difficult to get health care?
Well, I think that is somewhat addressed, perhaps in the interim. There's talk about whether there would be a necessity of increasing the number of physicians or health practitioners and things like that. But actually, in many places around the country, there's too many hospital beds. They're just positioned in the wrong locations. So, in under the single-payer system, people who go to med school will be given a free tuition, and they won't have any debts to go. So there'll be an encouragement to get people into that system, not simply to make money. And that's really what you have today. Is you have people coming out of medical school with tens of thousands, hundreds of thousands of dollars of debt. So they're driven not to do health care for a human right, but do it because of money, and that's just the nature of the system. So those are problems. There's always going to be problems with even with single payer. But the point is, you're able to deal with them in a rational way, not based upon profit, not based upon some personal personal gain from some physicians or insurance companies. The building of hospitals and the closing of hospitals, those are all issues. How much money are people going to be reimbursed? How do we ensure that there's enough nurses and enough practitioners, enough professionals? Those are all questions that will still be there under single payer, but they will be decided in a more rational, as I say, way, instead of being governed by profit.
Well, you touched on something about the staffing and the education of the staffing for healthcare facilities, that under a single pay system, that it would actually enable more people to get, to be educated and participate in the system as doctors and nurses, and prevent them from having to incur such huge debt, because now we've taken the money out. So you've actually, single payer solves two problems, one being the peripheral problem of educating the doctors and the nurses and the practitioners. So, I think that's a really good thing to focus on. The next question is, it seems to me the problem is the insurance companies and their profit-making mentality, but people really don't talk about them. Is this true, and should it be brought to light more? So the profiteering of insurance companies.
Yes, that is the problem, and I said that's part of. It's kind of related to the political problem, where we meaning our coalition and people who are advocates for single payer or alternatives to the current system, we can't get an opportunity to a megaphone. We aren't given the opportunity to speak to millions of people in the manner I'm speaking to you now. So therefore, they're constantly, streamed with Fox News and propaganda from the insurance companies, how wonderful it is, and so therefore people are, unfortunately, I would term, confused, or they don't have the right information. So that is a problem, and the argument or the answer is yes, we need to in order to get real change, we have to first focus on what the problem is. And the problem is the insurance companies. But I'll end the question by saying insurance companies don't heal the sick. They don't comfort the ill. The insurance companies don't drive you to in the ambulance. The insurance companies don't deliver your babies. They're just a payer, yet they run the system.
Right. So, good point. Somebody asked, do you think petitions are effective in helping to bring about the shining the light on the insurance companies? And I'll extend that to be, do petitions help to further the cause of single-payer health care?
Well, I think that in the context of some type of an immediate campaign, that we have petition campaigns around a lot of things, save a hospital, lobby your legislators, get them to sign on. So the answer is, do petition campaigns? Yes, they do. They can. But they have to be done with some tactical or strategic, purpose behind them. And just running around collecting signatures on a petition for single payer, that probably isn't going to do anything. But in the context of some specific campaign or strategy, yes, absolutely.
There needs to be some precision in whatever you're petitioning for.
Right.
Generally speaking, do doctors and nurses support single-payer health care?
Well, there are polls that show many doctor organizations actually do support single payer. There are supporters in the physician community for single payer. I wouldn't say that they are a majority, but they are a stronger current. If you took like 100 doctors or 100, let's say whatever, there's a good current of 25-30% of those people who support single payer. Yet, as I said, that isn't translated out into the time that those people are given to project their views to the country. They're shut out of the argument, and that's what happened in Congress. The same thing with nurses. The nurses, there's many nurses organizations that support single payer. Or I don't know if they're the majority, but they aren't given a commensurate amount of opportunity, which gets back to the whole point about the political system. It ties into,
This is why we need indie media, right? So we can start getting the word out. Somebody asked about how do you feel that the pharmaceutical corporations contribute to the problem? Same situation, I guess, as insurance companies.
Yes, they are the same, and in fact, under single payer, the government would be compelled to negotiate with those pharmaceutical companies to get a better deal. So even under this ridiculous Obamacare that we have now, the insurance companies and the pharmaceuticals companies support it because they claim that they voluntarily, which is a joke, wouldn't raise their prices over a certain period of time, and Congress bought that hollow argument. So yes, the pharmaceutical companies, the hospitals, industry, they are the people that are making money out of this system.
And then there was another question, which I think we answered earlier, about if the Supreme Court strikes down the health care bill, does that help the cause? And I think our analysis was either way, we're going to have to keep pushing single-payer health care. That it's not really going to matter that much either way, whether it's struck down or it passes.
If they strike that law down, there will be a more immediacy of getting single-payer reactivated to get it on the political agenda. Right. But if Obamacare is codified, or however you want to say it, if it's guaranteed a success under single-payer, the crisis will still go on. It will just be prolonged, I believe. Right. But we will still be doing our arguments in the same way.
Okay. Are there any other questions from the chatters and viewers? And Ed, this is the time where you can get up on the soapbox and tell us what you think we need to hear. If you have anything you'd like to add.
Really, in summation, I think I've kind of said it all. I just don't want to repeat myself. I think we need to, for the immediate future, we need to reassess who our political friends are and how are we going to achieve single payer. If we need a political solution, we had 78 congressmen who were Democrats, not one stood up for single payer. How can we get single payer? Are we going to rely on those 78 people again? Or how do we build a stronger mass movement on the grassroots to get real substantive issues and change coming about? Get involved in your union. If you don't have a union, get one organized and get your union to do something for single payer, not just, I use the argument, you could paper the walls with all the resolutions from the AFL-CIO for single payer. It's meaningless. It's like, sometimes it's just a hollow support. So we need to get real active energy behind some of these things, not just on the paper. And I'm confident that because the objective conditions people will live under are not going to improve, I hate to say that, the crisis will continue to get worse on economic level. Working people are hurting, students are hurting, people need jobs, and there isn't really there needs a new voice. You need a new agenda. Single payer is just one part of that, and if we all work together, we can achieve it.
thank you for that. And while you were talking, we got a couple more questions. Somebody asked,
Right.
what's your opinion on free national health care? Free national health care.
Well, I mean, technically, nothing's free. I mean, if people nobody went to work, there would be no wealth created. So it's like, I think that's maybe you could say this isn't free, but it's healthcare is a human right, just like public education. You have a right to public education, but the schools don't subsidize themselves, or they don't drop out of the sky.
Right. And here's a really good question, I think, is knowing that our government is broken and corrupt, how could we trust single payer if the government's the single payer?
Well, but I think it's kind of like the government isn't necessarily the enemy. The government, whether, like, for instance, like Social Security, people who get Social Security benefits, they get it from the government. That doesn't mean that the government is the enemy. People get Medicare from the government. That doesn't mean that the government is the enemy. The government may be the enemy when it drones bombs or when it cuts people off of Medicare, but that in itself is a function of the people. So if the people essentially have to control their government, that's really what democracy is supposed to be about. So the argument is, yeah, at this particular point, the ruling functions of government may be warped or perverted, but that doesn't necessarily mean it has to be that way. And my arguments are, whether it's labor law, Social Security, unemployment compensation, all those things that people say, well, why do you like being an 8-hour workday? Well, those are rules of the government, so we don't. The government could take them away, but that's only because we let them do it, and we can't let them do that.
I really like that answer because, essentially what you're saying is we don't have necessarily a bad system. We have bad operators.
Yeah, we have bad actors. We have actors in there, operating and hoodwinking people and confusing the public that they're acting in their best interest, and I think that our job is to say, whoa, wait a minute, we're the ones that represent the real interests of people.
Yep. We shine the light in the dark places.
Yep.
Well, Ed, I want to thank you. It's been a pleasure. Thank you for taking the time. And I have to say, I'm delighted because the conversation expanded beyond the subject matter, which was all very helpful. And I don't know if you're able to see our chat stream or not, but there's a lot of positive commentary to have a conversation with somebody that's not necessarily part of the Occupy, but is able to see the same vision and point to the same issues, and it makes us all very happy, and we're better off for it. Thank you for the education. We're getting a lot of compliments out of the chat stream. People are expressing their thanks. It was very informative. It was truly wonderful. I think you got a little fan club going on here, so that's always a good sign. And we really appreciate the work you're doing and the time and the effort that you put into this. And thank you for coming and talking with us and educating
I'll be glad
us.
to come again.
Okay, great. We would love that. We'll see how the Supreme Court decision shakes out, and then we'll do a follow-up, and you can tell us what we need to do on the ground. So before we sign off here, I want to thank Clearly, especially. She gets special thanks. She was the one that sought it out and put together this interview. She was our facilitator tonight. As always, everybody needs to understand that OPN is a team effort. We have a production team, and everybody works their butts off. I'm glad to see everybody here tonight. We're missing Chris again tonight. I guess she was probably busy in Nashville, but Uppity, it's good to have you back. Thank you, Hour, for mirroring us on your channel, and for other channels that were watching us. We appreciate your support and your participation. No, Ed can't see the chat. Do you want me to send love notes to him? So now your fan club's coming to the fore, And I want to thank everybody for being here, all the viewers, all the chatters, for your participation. We have a special greetings from Heidi, one of our chatters. So I think we must know a Heidi somewhere in here. But it's makes us really optimistic. This is what it's about. Is I like to say it's ordinary people doing extraordinary things. So we're so grateful for your work and spending the time with us. I'm going to sign off here and archive this, and I'll be back on the channel in just a moment. Ed, if you'll hang around for a bit so we can chat, then that'll be it. So thank you very much for coming from all of us. And I will see you guys in just a moment. I want to archive this.